Hello, my topic is extracorporeal photopheresis for colitis induced by checkpoint inhibitor therapy. Definition: extracorporeal photopheresis has been an effective treatment for graft versus host disease. It is a therapeutic product based on the biological effect of solar and ultraviolet A light. Colitis is a condition involving an overactive immune system. It's an inflammation of the large intestine colon.
Colitis is basically inflammation of the colon, and that can be caused by a lot of different things because it's so anything that causes inflammation of the colon gives you colitis. Now you can have infectious colitis, which can be from either Clostridium difficile, which you can get from antibiotics. You can get it from Salmonella or E. coli or any of those food toxins and give you infectious colitis. If you're an older person, you get something called ischemic colitis, and that's when a part of the colon doesn't get enough circulation or doesn't get enough blood, so it basically suffocates, and then you can get some inflammation of a certain part of the colon. Most common types of colitis is something that's called inflammatory bowel disease, and there's two different types of colitis with that. That can be either Crohn's colitis or ulcerative colitis. And those are inflammatory bowel diseases that patients can present with a lot of pain and bloody diarrhea. So when someone says they have colitis, it's more of a basket description of inflammation of the colon. And then you have to kind of work your way to find out what type of colitis it actually is. Yes, there are worse colitises, like the inflammatory bowel disease colitis is worse in the sense of it's a lifetime of this disease. So it's a lifetime of taking medications and managing the disease. Ischemic colitis or infectious colitis, those ones are more short-term and usually can go away within a couple of weeks. Then there's lymphocytic colitis or cholangiocolititis, which causes just watery diarrhea, which is a little bit tricky to manage because there really isn't any good medications to help manage those types of colitis.
Application in nursing. The main activities of nursing will be the following: monitoring of vital signs, provide help in decision making, provide positive reinforcement and emotional support, guide a proper diet. In the event that the patient has enteral nutrition, the following should be considered: do not mix with medication, do not treat the unclog the probes with a serum, perform frequent gastric lavage. Pros and cons. Pros: diseases treatment with photopheresis, cutaneous T lymphoma, autoimmune disease prevention and/or treatment of rejection in solid organ transplantation, prevention and/or treatment of graft versus host disease. Cons: contraindication of photopheresis, soral allergy, unstable heart failure or resin, treatment with ACEI, sepsis, systolic hypotension, lymphopenia, inadequate venous access.
Our immune cells protect us from harm, patrolling travelling to sites of infection or damage. These cells need to spot the difference between healthy and unhealthy tissues. For example, when our cells are infected with a virus, they need to be destroyed. Infected cells display different molecules on their surface from healthy cells, indicating they're damaged. Immune cells can recognize these signs of disease and pass on instructions that tell the infected cell to self-destruct. But when it comes to cancer, the situation is a lot more complicated. For a tumour to grow, it needs to avoid detection. One way tumours can do this is to produce molecules that can trick the immune system. One of these is called PD-L1. It interacts with a molecule on the immune cell, telling it to ignore the cancer. But researchers have now developed drugs to interfere with this process, allowing the immune system to attack the cancer. And for some cancers, these new immunotherapies look set to change the way the disease is treated.
I should apply in Ecuador. No RCTs were found that analyzed the efficacy of ACF for pediatric patients with chronic graft-versus host disease after ACT. ACF can be considered in patients with chronic GVHD that does not respond to steroids, and remember that this treatment is not supported by high-level evidence.
Way of immunomodulation, but there are also other strategies that are already used in clinic, in particular extracorporeal photopheresis, and it can be very useful to decrease the use of steroids in patients with acute graft-versus disease. And in our centers, we developed a strategy for the first-line treatment of patients with cutaneous acute graft-versus disease that associate both steroids and extracorporeal photopheresis, and we show that it leads us to very good overall response rate on acute graft-versus disease and a significant decrease of the use of steroids that translate into less side effect in the patients, and in particular next episode of fever and hospitalizations and an improved quality of life on our patients. So I think that this new immunomodulatory strategy are very promising, and that will allow to use less steroids in patients who have less side effect and improve the outcome.
Conclusion. FEC is an immunomodulatory therapy that has been shown to be effective in various diseases mediated by the lymphocytes and is characterized by its low toxicity compared to most immunosuppressants. Extracorporeal photopheresis has a good safety profile. The adverse effects that occur are mild and in most cases do not cause treatment interruption.
photopheresis and photodynamic therapy, in which blood is treated with a photosensitizing agent and subsequently irradiated with specified wavelengths of light to achieve an effect. Specifically, buffy coat WBC plus platelets is separated from whole blood, chemically treated with 8-methoxypsiralin, instilled into collection bag or given per OS in advance, exposed to ultraviolet light UVA, and returned to the patient. Activated 8-methoxypsiralin crosslinks DNA in exposed cells, ultimately resulting apoptosis of nucleated cells. The photochemically damaged T cells returned to the patient appear to induce cytotoxic effects on T cell formation. The mechanism of such antitumor action has not been elucidated. Photopheresis involving 8-methoxypsiralin was first described in a 1987 New England Journal of Medicine publication. Photopheresis is currently standard therapy approved by the U.S. Food and Drug Administration (FDA) for cutaneous T-cell lymphoma. Evidence suggests that this treatment might be effective in the treatment of graft versus host disease, though this evidence is largely observational and controlled trials are needed to support this use. Photopheresis has also been used successfully in the treatment of epidermolysis bullosa acquisita when all other treatments have been ineffective. Minimal observed side effects for patients receiving photopheresis include hypotension and syncope resulting from volume shifts during leukapheresis phase of treatment. Photopheresis is also used as an experimental treatment in patients with cardiac, pulmonary and renal allograft rejection, graft versus host disease, autoimmune diseases, nephrogenic systemic fibrosis and